Turning 65, that's a huge milestone, right? But it also means you're about to make one of the biggest health and financial decisions of your entire life, choosing your Medicare coverage. It can seem like this whole world of confusing jargon and scary deadlines, but don't worry, we're going to break it all down and make sense of it together.
So if you're getting close to that big birthday, you've probably started seeing the word Medicare pop up everywhere. But what does it really mean for your health? And maybe more importantly, for your wallet? In the next few minutes, we're going to give you a super clear roadmap, a guide to understanding the whole system, so you can feel confident you're making the best possible choice.
And let's be totally honest about the stakes here. This is not just about picking some health plan for a year. No way. Missing a deadline or picking the wrong coverage can literally lead to financial penalties that stick with you for the rest of your life, not to mention leaving you with huge gaps in your healthcare. So getting this right from the very beginning is absolutely essential.
Okay, so here's our game plan. First, we're going to break down the 4 basic parts of Medicare, the building blocks. Then, we'll dive into the real numbers, the actual costs for 2026. After that, we'll cover the super important deadlines you just can't afford to miss. Then we'll explore the 2 main paths you can choose for your coverage. And finally, we'll look at programs out there that can help you pay for it all.
All right, let's jump in. First things first, we've got to learn the language of Medicare. The whole system is built around 4 main parts. They keep it simple: A, B, C, and D. Once you understand what each one of these does, you'll have the foundation you need to make a really smart decision.
Let's start with Part A. Think of Part A as your hospital insurance. This is what kicks in when you're formally admitted to a hospital or, say, a skilled nursing facility. And here's some really great news. For most people, Part A is premium-free. Yep, as long as you or your spouse paid Medicare taxes for at least 10 years while you were working, you likely won't pay a monthly bill for it.
Next up, we have Part B, and this is your medical insurance. It covers pretty much everything you need to stay healthy outside of a hospital. We're talking about your regular doctor's visits, any outpatient care, lab tests, and preventive services like flu shots. So you put A and B together, and that's what everyone calls Original Medicare. Now, Part C is where things get a little different. You'll almost always hear this called Medicare Advantage. And it's not a separate benefit. It's actually an alternative way to get your Medicare. Think of it like a one-stop shop. Private insurance companies offer these plans, and they bundle Parts A, B, and usually your prescription drugs, all into one package. Sometimes they even throw in extra perks like dental and vision coverage. And finally, rounding out the 4 parts is Part D. This one is your prescription drug coverage. And it is incredibly important because Original Medicare, that's Parts A and B, remember, it just doesn't cover most of the medicines you'd pick up from the pharmacy. You can either get a standalone Part D plan to go with Original Medicare, or, like we just said, it's often built right into a Medicare Advantage plan.